Dr. Michael Tillman here, Tillman's Body Talk. Today we're going to talk about knee pain in the elderly. We're going to talk about osteoarthritis, bone on bone, total knee. And really what you're going to see is that the knee hurts when it loses motion because the muscles can't work properly. If we can get that motion back and the muscles start to work, they have significant improvement. So I do have people who are 100% bone on bone with no knee pain. We're gonna go through a knee. We got a patient who's female, 72. We're gonna look at both knees because she has bilateral knee pain. And I'm gonna show you the tests I do. I'm gonna show you how I would treat it and how I would progress it to get her to have a pain-free knee. If you can look, if I take her knee and I bend it, you can see how she's not getting all the way, and that hurts, right? A good knee, I should be able to bend it and not hurt. And when I extend, I can't really extend. It's almost like it's already bent. And so basically, when she stands, she's standing on a bent knee. When they do an x-ray, I can guarantee it's bone on bone. Do I think she needs a total knee? No. I think she needs to get her full motion. Then we know what happens. If she can lock this knee, she can use this quad properly. If she can lock the knee standing, then when she stands, she can rest a little bit versus always being on that joint and always wearing out. You see a lot of older men typically will stand with their knees bent, and those are the patients that are in a lot of knee pain. Level 1, the lowest level for the knee, is to sit on the edge of a chair. You'll straighten your leg, and you're gonna keep your toe relaxed, and then you slowly lean. You don't push on the kneecap, you push both hands on the middle thigh, and you start leaning and leaning and leaning, and you typically push pretty hard. And it's gonna hurt a little bit because you're gonna feel a stretch back, but then when you come off, the pain should go away. So how often? 10 times every 2 to 3 hours, or 6 to 8 times a day, because you're trying to remodel that tissue. So you need stretches all day long so that it constantly gets stretched, and then that becomes its new tissue, new stretch length. So go ahead and push, 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 and then she relax. And again, push, 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 and relax. How do we advance this? We add more load. How do we do more load? We do it on the wall. So what you do is you lean your butt up against the wall. The non-effective knee can bend, and then you start pressing in the same spot. So she'll put both her hands here, and she'll start leaning more and more, more and more and more, but it's more weight than the chair, so it's a stronger stretch. So now I'm progressing the force of the stretch, so I can remodel that tissue further and further. Again, how often? 10, 6 to 8 times a day. So she's push, 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 and relax. If I wanted to add any other progression, it would be maybe hold for 30 seconds or hold for a minute. I could do that after a week or so, just to give it a stronger but longer stretch. Okay. Now, after you start getting motion, what you want to do is you want to strengthen in that new motion. So your joint gets used to the new motion and your muscles get used to locking the knee. So go ahead and lock your knee as much as you can. Good. Now just stand up and lock your knee on your own. Lock it hard. And so what you can do is you can take a band and you can hold it. Go ahead and bend it and straighten it and bend it. And then just do this leg. Keep this one straight. Bend it. Straighten it. You can tie this up to a pole, like I said, and you can do 10 reps. About 5 sets of 10 would be great. Every other day would be great because you're trying to work that joint in the new motion to get this quad so she starts using it when she stands, when she goes upstairs. It's going to make her life a lot better. Okay, that's knee pain and that tolerates or gets better with knee extension. You want to be able to lock the knee, and that helps typically fix, in my opinion, 50% of the knees. I'll do another video on bending the knee, but a good knee can lock unloaded and with weight on it, because that's what walking is, that's what landing is. And so you can see the progressives of stretching are to get more weight on it to max what you want it to do all day. I'll do another video on bending and those knees that respond to bending, but typically we go after extension first. If that doesn't work, then we go after bending. So that's Tillman's Body Talk. Please like and subscribe to the channel.